Hello, I'm Dr. Greg Gordon, and welcome to your child's 4-month checkup. There are 4 topics I want to cover today: development, sleep, drooling, and starting solids. So 4-month development. A 4-month-old should be able to regard their own hands, bring their hands together, laugh, and lift their head to 90 degrees when prone. 4-month-old sleep. To me, this is the big topic at the 4-month checkup because 4-month-olds should be able to sleep all night. Now, my definition of sleeping all night is 6 to 8 hour stretches, which I set that goal because once we get to 6 or 8 hour stretches, then usually children just sleep longer and longer from there. The most common problem, meaning the most common reason why kids aren't sleeping well at 4 months, is usually the parents are feeding them too frequently during the day. That they come in eating every 2 to 3 hours when really a 4-month-old or a healthy, good-sized 4-month-old should be fed only every 3.5 to 4 hours. So 4-month-old not sleeping. First, we need to go back to our basics and keep our bright and stimulating day and dark and boring night. We need to continue our consistent bedtime routine. A full listing of our bedtime routine is available as a printable PDF either off my 2-week website page or off the 2-week YouTube video. And then we need to get those feeds spaced out to 3.5 to 4 hours. 4-month sleep. So once we have our children sleeping consistently at night, we need to keep them sleeping consistently. Children need, after 4 months, to learn to fall asleep on their own. If your child already falls asleep on their own, meaning you place them in their bed awake and they fall asleep, great. Most kids, certainly at 2 months, are being rocked to sleep or nursed to sleep or held to sleep and then transferred into their bed. After 4 months, you can't continue that. So when kids are consistently rocked to sleep or nursed to sleep, those kids can sleep well at this point, but usually between 6 to 9 months, those kids start waking up. So we want to prevent that. We don't want to get there. We want to avoid future waking habits. So starting now, try and put your child to bed awake. So simply go through your bedtime routine and put them in their bed awake. Now, hopefully they'll just fall right asleep and it'll be easier than you thought it was going to be. At 4 months, if you try and put them in their bed awake and they scream and cry and fuss, then simply go back to your regular routine, nurse them to sleep, rock them to sleep, and then try again the next night. Eventually, with your persistence, your child will learn to fall asleep on their own, and it should not be a painful process. 4-month drooling. First, it's normal. All 4-month-olds are drooly. The cause of drooling at this age is argued. Some people feel like it's children getting ready for teeth or getting ready for solid foods. Some people feel it's a developmental effect of children exploring their world with their mouth open. Neck rashes are a common result of excess drool, that when enough moisture gets in those fat folds between the neck and the upper chest, that children will often get red, sensitive rashes there. So let's talk a little bit about teething. Children typically get their first tooth between 6 to 8 months of age. For most kids, it's usually their lower central incisors, so the bottom teeth right in the middle. Symptoms of teething are argued, and we're never going to know, simply because there's no way to make a child get a tooth and find out what symptoms they have, or make a child not get teeth to see what symptoms they'd never get. Typically, people will talk about a runny nose, fussiness, and diarrhea as major symptoms of teething. I'm okay with periodic acetaminophen for teething. So when children are fussy and irritable and they just seem generally uncomfortable, it's okay to give them a dose of Tylenol. You can find a dosing table on my website or in my book. 4-month-old solid foods. So a lot of things to talk about relative to solid foods. When to start, what to feed first, when to feed, and how to start. When to start solid foods. I've long joked if you asked 10 grandmothers, read 10 books, and asked 10 pediatricians, that you'd have 30 completely separate answers to this question. So what does the American Academy of Pediatrics currently say? Well, there's two committees that look at this issue. The Committee on Allergy, Immunology, and Nutrition says that for all children, 4 to 6 months is the right time to start solid foods. The Committee on Breastfeeding wants parents of breastfed infants to wait until 6 months old to start solid foods. So the Cochrane collaboration is an international group, probably the world leader in what's called evidence-based medicine. Meaning, what does the evidence really say? Not what are Greg Gordon's thoughts, not what are other doctors' opinions, but what does the evidence really say? Their current statement says that exclusive breastfeeding for 6 months versus 3 to 4 months with continued mixed breastfeeding thereafter reduces the risk of gastrointestinal infection, helps the mother lose weight, and help prevent pregnancy, but has no long-term impact on allergic disease, growth, obesity, cognitive ability, or behavior. Which means for the big stuff, it doesn't matter whether you start solid foods at 4 months or 6 months. There's a little bit of advantage waiting to 6 months, but if you ask me, all the big stuff is anything after 4 months. What to feed first? So don't start with rice cereal. So really over the last 20 years, I and basically every pediatrician out there had focused on these allergy concerns and have been recommending hypoallergenic rice cereal as a first food. And for two reasons, I've kind of stopped recommending rice. One is there's really not any reason to feel that what you feed children early on in life plays into food allergies later in life. And two, there is some evidence that United States grown rice contains a minute amount of arsenic. So today, I recommend fruits and vegetables or grains as a first food, and really fruits or veggies is where we focus with our children. Probably the most common thing I'm hearing parents feeding their children today is avocado. So you can make your own foods or you can buy stage 1 foods at the store. I really recommend you buy at least a couple jars of stage 1 food so you can get an idea of what that stage 1 consistency is like. So when to feed? So between 4 to 6 months, you really just need to feed your child once or twice a day. If your child loves to eat and you love to feed him, you're welcome to feed him 3 or 4 times a day. But for most families, once or twice a day is plenty. Don't feed them solid foods when hungry. And yes, I know that sounds strange, but if your child wakes up after sleeping 12 hours and you start trying to spoon feed them applesauce, I guarantee that child's going to start crying and you're going to end up crying quickly. Feed them their milk first. If you breastfeed them first. If you feed them formula, feed them a bottle first. And then early on, at this point, the food is really more of an activity. It's more practice than actual nutritive substance for a child. Their milk intake. Between 4 to 9 months, most children's milk intake stays about the same. So for formula-fed kids, that's an average of 25 to 35 ounces a day. And really we just add solid foods slowly on top of that. So how to start? And this is really just an example. So in this example, we're going to start with squash, which is actually what we started our 8th child with. And during the first 5-day period, we're going to feed our child squash once or twice a day, every day. And of course, take lots and lots of pictures. During the second 5-day period, our second food is going to be green beans. And so for every day during these 5 days, we're going to feed them green beans. But if we want to, we could have squash as well. So if you want to do squash and green beans twice a day, great. If you want to do squash for morning and green beans for dinner, you can do that. So our third food we're going to try for our new infant is going to be applesauce. And so every day during that next 5-day period, you're going to feed them applesauce once or twice a day. You could have a big dinner during that time of applesauce, green beans, and squash all together. So the fourth 5-day period, we're going to introduce oatmeal. And during that fourth 5-day period, you're going to feed your child oatmeal every day. Now you could have oatmeal and applesauce for breakfast and green beans and squash for dinner. And so the idea is just kind of introducing one food at a time over a 5-day period. Relax and enjoy. And that's pretty much all we need to cover today. If you have any further questions, please see my website, gregorygordonmd.com.